us, we are so privileged to have honorable members in our own house. I mean, we normally go to Parliament, go and visit, but it's a great honor, and it's not a small feat. I think the intersection of our goals emphasize the importance of our collaborative efforts to address population and development issues in our countries. There's no doubt that your presence reflects our shared commitment. Some of the key issues that I would like maybe to bring to your attention: population growth is, I think, is quite high. As the President has said, the population continues to grow. Our annual growth rate is at 3%.
Now, we just want to say we are thankful that UNFPA has been of great help to us and has been a very key partner in our effort to bring the need for development of population and total development of Africa to focus. When you are talking about population in Africa, some key issues come into play. Maternal mortality is a critical issue. In Africa, we have about 530 deaths of mothers, in trying to give birth.
Teenage pregnancy has taken it on as one of the areas. For the last 3 years, it has been maternal deaths, addressing maternal deaths.
We know the challenges, we know the problems where they are. We've mapped out all the pockets, but the major challenge we are having is implementation.
I would request you to basically put more effort in the touch with the local communities in order to change the attitude.
In my culture, in my church, it used to be, the belief was that once a lady has produced, when the breast is coming up, that's ready for marriage.
Can't we review the system of our education, and then we look closer into core education at secondary school level? Because that is the age of adolescence, and the two partners are attracted to each other. So whatsoever measures we can do, I don't think that we'll be able to create a bar to separate them just like that. It will not get rid of it completely, but it will reduce because too close to each other can facilitate whatever. Thank you very much.
I really thank you very much for the support, and we promise you for the meantime that the space is small, but we can share with you. Because whatever we do, we are doing together for a common purpose. So for the meantime, it's a pleasure not to worry. We will take care of the family here. Great. I thank you very much. I think we shall continue this.
I'm glad for your visit here. I can see you're in very able hands. Senior Investigator Uganda John Priest Magora. The topic you're tackling is something which Africa must focus on deeply, because when we look at the population explosion that we are having, can either be a challenge or an opportunity. And the bigger challenge we have is the one of making it an opportunity. But because on the one of being a challenge, that's very, very easy. I have in my constituents and most of the constituencies, especially the rural areas, some people tell you that for us our role is to produce, the rest Museveni will look after the children. Because of free education that we are giving in Uganda, because of free immunization, free medical services, men will remove the graduated tax, which was a problem. So even if you keep drinking, your wife will look after you, then for you become a sperm donor and you produce all children you want. So but it's a huge challenge. So these are issues we have to tackle. But I wish you the best. I've been interested in your course, and I want to thank the colleagues who have hosted you. And I also hope now for you who are believers, you're going to go to heaven. Because you can't go to heaven if you don't come to Uganda.
Naguru is where you can go and receive any service you need without being victimized, without being discriminated. What we have learned over time by doing this work is that school is protective against teen pregnancy. When kids are in school, we get an average pregnancy rates of around 4% for the young people we test out of 100. But when they come back for holiday, it shoots up to 40%.
Honorable Dr. Abdul Hassan, the President of the African Parliamentary Forum on Population and Development and the Chairperson of the Ghana Parliamentary Network on Population and Development, Senator Frederick Outa, the Vice President of the Forum, the delegation you're leading, the management and staff of Reproductive Health Uganda, and all protocol observed. Good morning to you all. We are elated to welcome you at Reproductive Health Uganda, a service delivery advocacy working towards championing and sustainably providing capacity building, research evidence, high quality accessible rights-based SRHR information. And at this point, I would like to welcome the Executive Director of Reproductive Health Uganda to officially welcome you to our premises. Thank you.
Good morning. We want to say that Reproductive Health Uganda, an organization whose main focus is sexual and reproductive health. We were born in 1957. We pioneered family planning in this country. We also work very closely to educate the young people, give them information so that they can make informed decisions to guide their future. We also have a network of facilities, service delivery points, where we provide actual services. And we've just come back from a tour of one of our facilities. This is one of the humble clinics we have.
Important statistics for us that guide our programming as an organization. I think by now you already know that Uganda is a very young population. with over 75% of the population below 30 years of age. The poverty levels are still high, and of course that affects how well the young people and the general population access social services. The teenage pregnancy remains one of the highest, probably on the continent, averaging at 24%, but we have districts that are very close to 40%.
I, Martha Mugabe, on behalf of Reproductive Health Uganda, extend my sincere thanks to the Almighty for making today's visit a success. Today we have had an opportunity to get some insights, and this will surely encourage us in our endeavors to advance the SRHR needs for young people and the community at large.
Well, one of the most famous quotes says, "Empower the youth today and they will build a better tomorrow." Well, during my internship at Reproductive Health Uganda, that's in 2022, I found myself immersed in an impactful whirlwind of experiences. I engaged in a multitude of activities. I witnessed RHU's unwavering dedication to the community firsthand. Grateful for the opportunity to be here, and I'll forever carry on these lessons that I learned from RHU to make the world a better place and a meaningful endeavor towards young people. God bless you all. Thank you for listening.
We joined RHU via a community center of refugees called Makasi in 2020. We managed to go through a training for a full week, basically on how to handle and approach people in the community. And we were also shown how to use the reporting tools and referral notes and all the information in regard of SRH and rights.
We have resources in Uganda. The problem is how we manage it. The same problem we are having in terms of population. We have to address this issue seriously in our villages. Where I come from in Amuru district, when a man has only one wife, you cannot talk in public. I thank you very much for visiting us. Let me take this opportunity to invite the President. Honorable, welcome. Thank you.
This has been a very impressive one. What we have